Hi there. This is Dr. Lawrence ROBERGE, and I'm going to talk to you a little bit about acid-base balance and why this is important. And furthermore, when you have abnormalities or pathologies involving acid-base balance. So what we're going to do is go into some of the terms just to get you familiarized with them. First off, when we talk about an acid, it's a substance that breaks down to release hydrogen ions. You can see H pluses. So usually the pH is always going to be decreased. When we say something is acidic, it is a substance with a pH below 7.0. That's sort of a balance there between at 7.0. So anything that's acidic, the hydrogen ions, the concentration of them tend to predominate. For a base, it's a substance that breaks down to release hydroxide ions, as OH minus, or it will accept hydrogen ions. So it kind of like a sponge absorbs them. Whatever way it works, it will increase the pH. If I say something is basic or alkaline, it's a substance with a pH above 7.0. Hydroxide ions are going to predominate. By the way, hydroxide ion is an O and an H. Plus a hydrogen ion, which is an H, you get H2O. That's one way you can neutralize something where you basically have the hydrogen and the hydroxide come together to form water. But let's move ahead to a couple of other terms. One of them is pH. Now, this gets a little tricky. Some people flip out because of the math. Don't panic about this. I'll just give you some of the basics to keep in mind right now. It's a negative exponent of hydrogen ion concentration. Oops, what does that mean? It's a measure of hydrogen ion concentration. It's based on the power of 10. Here's the basics. Anytime that we say a pH and we give it a number, let's say 5, and we drop the pH to 4, what we're actually doing is increasing the concentration of hydrogen ions by a factor of 10. So if I go from 5 to 4, I've increased it by 10 times the concentration. If I go from 4 to 3, the hydrogen ion increases again by a factor of 10. So basically, if I went from 5 to 3, 10 times 10, I've increased the concentration from the pH of 5 to the pH now of 3 by 100. If you get confused, think about it this way. The more higher the pH number, the lesser the concentration of hydrogen ions. Whereas the lower the number of pH, the higher the concentration of hydrogen ions is. Okay? Buffer. That's a substance that opposes changes in the pH of a solution by removing or replacing hydrogen ions. If I say something's neutral, it's a solution of pH at 7.0. So in essence, there's equal concentrations of hydrogen ions and hydroxide ions. Now you've seen this chart before. You can see, I want you to focus more on the concentration moles per liter of hydrogen. You can get into the hydroxide, and if you're really into the chemistry of it, it's cool. But you don't need to really fuss about household bleach, ocean oven cleaner, lye, or sodium hydroxide. Just don't eat it and don't drink it and anything else, because it wouldn't do wonders for your tissues. It would really destroy them. But take a look around the neutral area, which is 7. Remember I said 7 has got equal concentrations of hydroxide ions and hydrogen ions. And blood has a pH of 7.4. Well, actually, we're going to expand upon that because the reality is that all biological fluids have got to have a pH of somewhere between 7.35 and 7.45. So they average it out 7.4 in this chart. Notice that as you get more and more acidic, in other words, the pH drops a number, you go from milk to black coffee to wine, oh my, to lemon juice. You're getting more and more acidic. But why does that play such a role with, the fluid compartments of our body? Well, what you have to think about is this. There are major compartments of fluid. The pH has to be set in a certain way just so that biochemical reactions can occur. Now, there are really two, actually, we call it sort of two or three sections where we have fluid volume. Intracellular, whenever I say intracellular, it's inside of the cell. So inside of all the cells, that's a lot of fluid there. When I talk about outside of the cells, that's the fluid surrounding cells called the interstitial fluid. Or the other major source of extracellular fluid is plasma volume. Okay? So when I talk about ECF, that's extracellular volume. When I talk about ICF, that's inside the cells, intracellular fluid volume. But in all those fluids, you have to maintain a certain level of pH. In other words, concentration of hydrogen ions. The problem is we don't usually have very strong acids, and you wouldn't want them because what happens is that in fluids, like liquids, solutions, strong acids will immediately dissociate. So take a look at HCl, that's hydrochloric acid, immediately just turns into just hydrogen ions and chloride ions, and that would be bad news for tissue, my cells and all that other stuff. But take a look on the right side there where it's H2CO3, which stands for carbonic acid. The interesting thing with weak acids is that they do not completely dissociate. In other words, break apart into ions. Some of the molecules stay intact. You notice that the H2CO3 is still there in the green. There are some of them that dissociated. They broke up and basically became a hydrogen ion. And the HCO3 negative is a bicarbonate ion. Yep, just like you'd see with sodium bicarb, except with sodium bicarb, you've got the bicarb ion and you've got the sodium, which would be plus. Okay? Now, that brings us up from acids and bases to buffers because I know if I added a strong acid, even if I added a weak acid, I'd still be shifting the pH, and I can't do that much. But there is a substance that allows us to mute or reduce the impact of the changes when we have a possibility of a pH change when acids or bases are added. And look, in the body, there's a lot of different acids and bases that are out there. What keeps them from just going completely shifting all sorts of things and messing up our biochemistry? Buffers. So what's a buffer? It's basically a solution that has the ability to maintain pH, bring it back to its optimal value by addition or removal of hydrogen ions. Take a look there. There's the buffer plus the hydrogen ion. And you notice those purple arrows that go back and forth? That's saying that the reaction is reversible. It means it could go in one side to the left or go in the other side to the right. It goes on to the other side to the right. The H plus buffer means that the hydrogen is being reattached to the molecule of the buffer. In going to the left, shifting to the left, the buffer loses the hydrogen ion, but that hydrogen ion can there interact with other ions and neutralize things. But what's the key point? Key point is that buffers resist changes in pH when acids or bases are added. Here's another example of this. If I take molecule HY, which is a buffer, and you notice the double pointed arrows there, double arrows, on this line here, basically seeing the reaction go back and forth. It can go HY to hydrogen ion plus the negative Y ion, or the negative Y ion plus the hydrogen ion can reform HY. Again, this system relies on weak acids, so that, in other words, it's an acid that does not completely dissociate. Some of the anions remain with their hydrogen atoms attached. This is with buffer systems. Now, what does this all mean? If the pH drops in, let's say, inside your cells, in your blood, etc., you have a means to blunt or reduce the impact of that pH drop. Because if the pH drops, you have excess hydrogen ions present. And so the anion, that stripped off part of the buffer, will bind to that excess of hydrogen ions, and that will cause the pH to rise. And the weak acid of the buffer system will increase in concentration. Now, what if the pH did the opposite? pH rises, which means that the hydrogen ions are decreasing. Oh no, I need more hydrogen ions. Okay, so the weak acid part of the buffer releases the hydrogen ions, and that will decrease this pH, which was rising, and it'll leave behind the anion of the buffer. I'm going to take my pointer and point it right here in the center here. Here is how the buffers. Now, some of the buffers have dissociated. So I've got hydrogen ions floating around, and I've got the HAN ion here, the AN ion. And I've got some of this buffer not dissociated. Notice it still has the hydrogen right there. But if I add more hydrogen ions, what happens? Well, those hydrogen ions get attached to some of the very same buffer ions that needed the hydrogen. They become neutral. But what if the opposite occurred? I added OH. Now, if I add OH, what's going to happen is I'm going to need to reduce the impact of this rising pH level by supplying more hydrogen ions. And what does that mean? Well, the buffer lets go of some of its hydrogen ions. But here's the interesting thing. Remember I said H plus OH? So hydrogen ion plus hydroxide ion makes water? Well, here we go. This water molecule formed, this water molecule formed, this water, and basically some of the buffer molecules let go of their hydrogen ions, and you ended up forming more water. But why a buffer system? Why do we need this? They're essential for living systems. A lot of the metabolic reactions can only occur at a narrow pH range. While you're sitting here watching my video, you are breathing out carbon dioxide. Meanwhile, you are metabolizing, you're making some acids, you're making some bases in the cells, and some of them are being secreted outside of the cells. So what you want to do is, instead of having these rapid shifts in pH going, from 7.35 to, wow, 8.7, you've got buffering systems that will release hydrogen ions. If you go too much in the alkaline range, absorb excess hydrogen ions so you don't go too deep into the acidic range. This is how you maintain changes in your body. You manage them, I should say. Despite these changes, you will continue to maintain homeostasis. In other words, maintain normal function. Those select metabolic reactions will not be affected by rapid and intense shifts in the pH. I hope that makes it clearer. Now, there are three major types of buffer systems: carbonic acid bicarbonate, the phosphate buffer system, as well as the protein buffer system. I'll go through them quickly. Mostly the bicarbonate and carbonic acid systems are found in extracellular fluid. So remember, ECF is basically interstitial fluid plus blood. Okay? Now, the neat thing is this: it's a real simple formula. Carbon dioxide and water come together, they form carbonic acid. But carbonic acid is very unstable. And what you'll have eventually is the release of a hydrogen ion and a bicarbonate ion, unless you have too many hydrogen ions. And then the hydrogen ions will attach to the bicarbonate ion and shift the reaction back to making carbonic acid, and maybe even then pushing it all the way to carbon dioxide and water. The main point is, look which way you have. Do you have excess hydrogen ions arriving? Then you're going to shift to the left. If you have a decrease in the presence of hydrogen ions, such as having an increase in the pH, the reactions will shift to the right. Whenever you're going toward more a basic or alkaline nature, you will liberate more hydrogen ions to kind of blunt or neutralize that pH shift. Okay? Also, in this system, as a result, you form bicarbonate ions. We can use those in other places. The second type of major buffer system is the phosphate buffer. It's located in intracellular fluid. It's very important in the pH balance of both urine and in the intracellular fluid. Basically, you can see here we have dihydrogen phosphate. And in this reversible reaction, you have the release of hydrogen ion, and then you form, as a result of the loss of the hydrogen ion, monohydrogen phosphate. It's a very simple ion. Now, the last one is the protein buffer system. But keep in mind, what is the building blocks of a protein? Amino acids. So wherever you have proteins, you're going to find this. And so that's located, this buffer system, both in ECF, extracellular fluid, and ICF, intracellular fluid. Buffering effects are mostly due to the amino acids that make up the proteins. It's the amino acids that are going to either give off or bind hydrogen ions. So where are you going to see this? Well, it's going to be all over the place. You're going to see it in hemoglobin in the red blood cells, in the plasma proteins in the blood. You will also see it in amino acids in many of the proteins. Almost all the proteins will have some amino acids that can either attach, add on hydrogen ions, or give them off. And so this is going to occur inside the cell, outside the cell, in the fluid between cell and blood, and in the blood itself. Okay, so you've taught us about buffer systems and acids and bases, but what happens if the pH levels exceed the normal physiological range? Good question. Normal pH range for all the body fluid levels is 7.35 to 7.45. Okay, that's normal pH. Anytime you go for a blood test, they do a blood, they check the pH, and of course it comes in, oh, you're fine, you're 7.4, you're doing great. Yeah. What happens if I was below 7.35? That's known as acidosis. What happens if the pH of my blood or pH of my fluid was above 7.45? Well, that's known as alkalosis. You can see on the happy charts there, you have normal pH, you have alkalosis, the person's not doing too well. Go above 7.8, oops, you're dead. That's not good at all. So you want to avoid this. Also, you don't want to get acidosis because you get into that range, something's really wrong. And of course, you go below 7, you're looking at death. That's not good. How do we have these imbalances? Well, there's two major, we'll say, types. And there's going to be the two subtypings of that, and we'll get into that in a second. But first, I want you to understand respiratory. The focus is on the respiratory system for problems and for its correction. As for the metabolic acid-base imbalances, the focus is beyond the respiratory system. It usually includes the renal function, endocrine levels, drugs, alcohol, opiates, barbiturates, we'll get into that in a minute, as well as a certain brain activity, okay? So, how does this occur? I'm going to break this down to the chart. I will skip a few points just because I don't want to get too heavy into it right now. Respiratory acidosis, this is referred to as being caused by hypo, meaning lower, ventilation. So you're not having as much gas exchange because you're not breathing, doing as many breaths. And what happens is this, you're going to notice that the partial pressure of carbon dioxide, in other words, the quantity of it is going to build up. At the same time, you're going to notice the pH is going to drop below 7.35. Why? A lot of times this is due to impaired lung function, so chronic bronchitis, cystic fibrosis, emphysema, impaired gas exchange. That can be because of the actual respiratory membrane, the membrane space between, or the membrane lining that really is between the alveoli space and the capillaries is getting too thick, so there's not as efficient gas exchange. Alveolar PCO2 ventilation has been impaired. Impaired ventilation movement, in other words, this is more bigger, okay, more at the gross anatomical level. What do I mean by that? Paralysis of the respiratory muscles, a chest injury, chest puncture, you end up with a collapsed lung. You can have this also due to extreme obesity. Now, the last cause for respiratory acidosis, narcotic or barbiturate overdose, or injury to the brainstem. Now, the brainstem has a couple of different sections that control both the rhythmicity and the intensity of respiration, okay? But then you also have the problem of drugs. They will result in hypoventilation and eventually respiratory arrest. Case in point, opiates. Somebody has an OD, they overdose on opiates. One of the things that you're going to find people doing is that as soon as they stop breathing, they will artificially ventilate the person at the same time giving them Narcan. Narcan will block the effects of the drug, but only as long as the Narcan's in there. Meanwhile, while they're unconscious, they're not breathing, you've got to help them get gas exchange. You're going to be doing artificial respiration, basically ventilating the patient. Now, what about respiratory alkalosis? This is hyperventilation. This is where you basically will have the pH rise above 7.45. The partial pressure of carbon dioxide, of course, decreases. So there's not as much carbon dioxide in the tissues, in the blood, etc. How can this happen? Well, if you've ever seen somebody with pain, anxiety, fear, panic attack, the panic attacks are particularly those that we see nowadays. They're breathing fast, 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 fast. And what happens is they get rid of a lot of these CO2. And so that begins to push the pH of the blood, for example, above 7.45. Hypoxia, okay, can be caused by asthma, pneumonia, high altitude. High altitude, yes. What we're talking about is this. What you have to think about is you go to Denver, go to some of the higher altitudes, what happens? The quantity of oxygen in that thinned air is less. Your body will attempt to increase its ventilation to compensate for the lesser quantity. That's what the PO2 means, the partial pressure of that oxygen in the air you breathe. Now, as you increase your respiration, hey, that's great. You're getting more O2 in there, but it's at the expense of the excess CO2 excretion. So you're pushing the pH above 7.45. Sometimes you can also have a brain tumor or injury, and that's going to cause abnormality to respiratory controls. Now, let's get to metabolic. I'm only going to touch on a few of these, so you're going to be responsible for them. The endocrine situations and the endocrine controls, I'm going to try to stay a little bit away from right now. What I would tell you is that with metabolic acidosis, remember, this is all usually uh, caused in part by factors other than respiration exactly. So, what happens here? Metabolic acidosis is you're having the pH drop below 7.35. The bicarbonate ions are less than 22 milliequivalents per liter, which is another nice way of saying a lot lower amount of bicarbonate there. Why? Because you're going to have the buildup of hydrogen ions. How? Well, one of the ways is severe diarrhea. As you are pulling out the bicarbonate-rich intestinal secretions, et cetera, from the system as you are having the diarrhea, you're not having these bicarbonate ions being reabsorbed. They are going to be replaced by the renal mechanisms, and that's going to generate new bicarbonate ions as you're attempting to rebalance the system. Renal disease is another one. In that case, it's pretty straightforward. When you have renal disease, you end up with having the kidneys not functioning as well, so they're not going to be able to get rid of acids formed by normal metabolic processes. Untreated diabetes mellitus, really straightforward. If your body does not have the capability of using glucose for fuel, it will start to shift over into things like fats. And when you break down fats, you start making ketone bodies. This is where you get into ketoacidosis. Ketones will end up having a lower pH influence on the tissues and on the fluids, etc., because ketones themselves are somewhat more acidic. So what happens is, as you start burning up all the fats, you get an abundance of what they call ketone bodies in the blood, and that's going to shift the pH down. Starvation does the same thing. In this case, you're not getting the proper dietary nutrients. The body will start breaking down proteins as well as fat reserves, and both of these will end up leading to more acidic metabolites. Excessive alcohol ingestion results in the release of excessive acids into the blood. Now, let's move to metabolic alkalosis for the time that I have remaining. Remember that the pH is going to be greater than 7.45. Your bicarbonate ions are going to be somewhat elevated, but here's the main point. How does it happen? And it doesn't seem like it happens very regularly. Well, thank goodness. One of the ways to get metabolic acidosis is excessive vomiting, or they would say gastric suctioning. Why? Because when you vomit up, you're going to be losing hydrochloric acid. Now, the formation of hydrochloric acid is done in the stomach, where basically carbonic acid is broken off into the bicarbonate ion and the hydrogen ion. The hydrogen ion is used to make HCl. No problem. New hydrochloric acid replaced. But now that bicarbonate ion gets dumped back into the blood. As a result, it shifts the pH up above 7.45. Okay? Now, some of the diuretics will have this effect. Also, interestingly enough, ingestion of excessive sodium bicarbonate. To help you to understand this and appreciate it, about 50 years ago, one of the major antacids was sodium bicarbonate. And sometimes people who had ulcers and other types of ailments would consume a lot. Nowadays, you don't see as much use for sodium bicarbonate as an antacid, but you do see it when you have athletes who are going to do endurance things like races and other Olympic games and events, because what they do is they try to load up on bicarbonate to neutralize the buildup of lactic acid as their muscles are working. The problem is you're going to disrupt the natural alkaline reserve and you're going to shift the pH upwards to 7.45 or further. Okay? Now, as I run down on this, I want to give you a thought. I want you to review terms and let's go over some questions in a few minutes. But here's one thought. In the International Space Station, oxygen is kept at a constant level in the atmosphere of the station. Why do they have to scrub out the buildup of carbon dioxide? Keep in mind, no, they don't have lots and lots of plants to eat it all up. Answer. One of the things you have to understand is this. In a closed environment like the space station, or it could be the same thing as if you were in a submarine at the bottom of the ocean or something like that, you're going to have the problem of a certain amount of oxygen supplied, a certain amount of CO2, but they're not controlled in the way that we see on Earth, where, oh, carbon dioxide I breathe out, plants take it in, they make oxygen, they breathe that out. Yeah, right. In the ISS space station, they have a sponge-like material called zeolites. They have tiny pores and they basically will lock in the CO2 molecule. Then on the space station, the zeolites empty their CO2 when they're exposed to the vacuum of space. The big issue is this: carbon dioxide is toxic. Now, you all heard about carbon monoxide, but this is dioxide. Really? Yeah, but you got to think about this. In the average atmosphere, it's much less than 1%. You don't have the toxic effects. You don't want the toxic effects because you'll suffer certain symptoms. Now, keep this connected. The buildup of carbon dioxide beyond certain conditions will start affecting you from the perspective of respiratory acidosis. Okay? And that's going to start knocking out of kilter metabolic activity, brain function, normal body function, etc. At 1% of carbon dioxide, you're going to suffer from drowsiness. At 3%, impaired hearing, increased heart rate, and blood pressure. And you're going to also have stupor, which is basically saying they're somewhat responsive, but they're somewhat not, and they're not really in the right mind. At 5%, you will suffer shortness of breath, headache, dizziness, confusion. At 8%, unconsciousness, muscle tremors, and sweating. This is where you really are having a bad day because of the buildup of CO2 and you can't get rid of it. That's why they have to get rid of it in the space station. And by the way, above 8% is death. Thank you very much for this time and for this opportunity to present. And I hope you have a nice day.